So, South Africa is on the brink of a nationwide third wave of coronavirus infections, and 4 provinces are already in the throes of that phase of the pandemic. Now, this development informed the National Coronavirus Command Council's decision to place the country under a higher lockdown alert level. Under level 2, a curfew starting at 11 p.m. and ending at 4 a.m. is in place, plus restrictions on both indoor and outdoor gatherings. President Cyril Ramaphosa earlier this week saying that the onus is on this nation, as the severity of the third wave will be determined by the amount of contact we have with each other. The question now is, how severe is this third wave likely to be, and if these new restrictions will actually help, quote, flatten the curve? Let's get a sense of how this is all likely to pan out. Bring in Acting Executive Director at the National Institute for Communicable Diseases, Professor Adrian Puren, joining us now via our video link. Prof, thanks for always making time. It's great to chat to you again here on Newzroom Afrika channel 405. So perhaps what's most notable is that these latest restrictions are being met with, call it, ramped up vaccinations. I wonder whether or not that for you makes the difference.
Well, I think the vaccines certainly contribute, but I think not to the extent that we would think in terms of the general population. I think what is critical is that at this particular resurgence, if you like, we certainly have the healthcare workers vaccinated. And as you know, the healthcare workers have certainly been a vulnerable group. However, if you think more broadly around this particular resurgence, my sense is that if you look at the model scenarios that have been painted, we should not expect a resurgence to the extent that we did in the second wave. It should really be different, except perhaps for Gauteng. And as you've seen, the inflection point shows a very rapid trajectory in the case of Gauteng. So the interventions that the government has made certainly should contribute to trying to stave off that third wave while we certainly roll out the vaccine program. But it again comes back to the fact is, what is the extent of our implementation of those non-pharmaceutical interventions, such as the wearing of the mask, the physical distancing, which has been really emphasized, the management of congregant events and those numbers, and ventilation. So all of these factors, depending on the strictness with which they're being implemented, can certainly affect how that third wave will look like.
Yeah, I want to hone in a bit more on what vaccinations will mean for us at this stage of our fight against COVID-19. Some criticism being leveled against government for being in discussions, for lack of a better term, with China and Russia to try to secure the Sinopharm and the Sputnik 5 vaccines respectively. My understanding is that the pushback is because there isn't enough data to show that these particular vaccines are effective against the variant first found here in South Africa. Is that enough reason, do you think, for us to be extra cautious in going down that route as we try to diversify the candidates of vaccines we have?
Yes, I think we should, and I think the South African Health Products Regulatory Authority has stated that as a key commitment to the South African citizens, and that is that we want a safe and effective vaccine. So I think that the Sinovac has certainly gone through some level of peer review in terms of its particular efficacy, but again, and I have not seen any data for the Sputnik in terms of peer review. So again, I think the regulatory authority has a duty to the citizens of South Africa to evaluate the data that is coming through and determine whether or not what that data is showing in terms of efficacy and safety. My sense is that, given that some of the data that has been revealed, it's likely to be within the realms of what we're seeing with, for example, the Pfizer and the AstraZeneca, and, for example, those two vaccines, for example. So it's within those realms. But again, we need to see the data,
right, and
the data needs to be evaluated by an independent body to come to a conclusion whether we should include those vaccines or not.
Yeah, but what's the stance generally around the current vaccines that have been approved elsewhere? I mean, is the fact that these vaccines prevent severe illness and death not enough?
Yeah, I think that those are critical components to the vaccine, essentially, especially as we are focusing now, for example, on individuals who are in particular age categories with or without comorbidities. So that's really going to be critical, and that applies to the healthcare workers as well. So that's very important. Also important is the safety of these particular vaccines, so those vaccines that have been shown to be highly effective, highly safe, as well as the fact that we wanted to understand a bit more about onward transmission. And again, I think there's growing evidence that, in fact, not only will you prevent severe disease, but also onward transmission as well. So these vaccines certainly have a great deal of advantages to them.
Right. Let's talk a bit more about transmission. In case some people missed it, we don't want the virus to keep spreading because that gives it an opportunity to mutate. One of the most latest headlines I've seen is coming out of Vietnam, where there's now talk of a hybrid variant, some kind of amalgamation between the variant first found in the UK and that first found in India, joining forces, for lack of a better term. You've got the scientific words for it. And that obviously complicating the fight against COVID-19. What do we know about this hybrid variant and how it works?
I have not seen much on that in terms of the scientific publications at this particular point. I think what we need to be concerned about are the fact that there are variants that were derived from India and from the UK that were initially identified in South Africa a few weeks back. So what will be really critical for us is to really keep a track of those particular variants, because those, if you look at what's happening in the UK and in the United States as examples of variants and the effect they have in terms of transmission, those are highly transmissible viruses. So it's really important, at least in the case of South Africa, to really keep track of those particular variants and or any other variants, because those may well displace, if allowed the opportunity about transmission, then those can actually displace and have a more marked or significant effect in terms of a so-called resurgence or third wave.
Right.
I'd like to add, we went through a very remarkable resurgence during the December, January, February period. And so I think we also would expect some degree of immunity or greater degree of immunity to be present within our different communities, which will also affect the extent of which this resurgence will also occur. So I think that's an important contributing factor.
Yeah, it is. But I mean, top of mind also is concerns raised in some quarters that, part of what really makes the fight against COVID-19 complex with variants is that just because you had the virus before, it doesn't mean that you become, quote unquote, immune to a different variant thereafter. How much do we know about the ability for people to continuously get infected with the virus now that we have multiple variants at play?
Yes, so again, looking at the experience in the United States, for example, again, the numbers of so-called breakthrough or vaccine failures have actually been very minimal in terms of the context of the total numbers of vaccinations that have occurred. So I think we will expect it. It should not be common, and we should expect a certain degree of protection. Similarly, within South Africa, with our current variant that is dominant, we should expect not to see the extent of vaccine failures that says that this is not an efficacious vaccine.
The ideal situation to be in, of course, is to have the kind of vaccine that would be able to fight any kind of variant. Am I building castles in the air, or is something like that really probable in the world of science, at least insofar as things stand?
Absolutely. If you look at the scientific literature, and this applies to influenza as well, the holy grail is to have a universal vaccine. And I think there are attempts to try and build, if you like, a universal vaccine for COVID-19. Because coming back to your point, is it the fact that the duration of immunity will result in us having to re-immunize or revaccinate? Or will there be a sustained level of protection? Currently, there is evidence, of course, that there is so-called waning immunity, but waning immunity does mean that it's disappeared. It may still well be there. And we also need to consider that there are also the T-cell arm of the immune system, which can certainly add a level of protection as well. So all these factors, so you're quite right, a universal vaccine will be wonderful, but it's also the duration and type of responses that will also be critical around that particular vaccine. Yeah,
speaking of that, we know that the Pfizer vaccine currently being used predominantly in phase 2 of our vaccination drive is a 2-shot jab. There have been different comments around the duration between the first and the second in order to maximize immunization from the vaccine itself. I mean, what is the, call it, dominant voice from the world of science about how long the duration between the first and the second jab should be?
So again, this has been variable, and I think there's been some data coming out from, I think, the UK as well, that you can certainly extend the gap between the first and second, I think about 3 to 4 months, for example, and that should allow you some degree of efficacy to the same extent as, for example, minimizing it, I think, to 21 days or thereabouts as well. So again, if you think of a strategy to try and enhance the coverage, then perhaps you would think about extending that period between first and second vaccinations.
Yeah, they're all really food for thought. Thanks very much indeed for getting us a sense of what we know about not only the virus but the variants at play as well. Really appreciate your time. Professor Adrian Puren, the Acting Executive Director at the NICD.